Hello, I'm Joanne McKenna from PPL Biomechanics in Cork. I'm a podiatrist and I'm passionate about preventative medicine, multidisciplinary practice and offloading. International guidelines tell us that pressure offloading is critical for the prevention and healing of neuropathic diabetic foot ulcers. Whilst multiple interventions are typically required to heal ulcerations, such as local wound management, infection management and revascularization, the guidelines state that pressure offloading is arguably the most important intervention of all. Because of this, offloading is interwoven into HSE programs of care and Slauncher Care initiatives. This is no surprise, as research shows both the healthcare and amputation costs related to diabetic foot ulcers is far from positive. Pressure is everywhere in 2021. Our resources are stretched. Unfortunately, we can't offload all these pressures. But it is often simple and always cost-effective to offload pressure on the diabetic foot, using basic mechanical principles and providing our patients with an offloading solution. We can use a combination of mechanical principles and products to offload the foot. We can reduce movement, steer force, reduce pressure, deflect pressure, and support the foot shape. The international guidelines provide us with advice on how to do so based on risk. There are many offloading solutions and products: total contact casts, walker boots, offloading shoes, foot orthoses, and preventative medical grade footwear. Offloading solutions can be custom made to provide an exact fit, which is most important when foot deformity is present or impending. All offloading solutions have pros and cons and different levels of mechanical and therapeutic effectiveness. Product selection and prescription should ideally be based on patient risk, patient needs, and most importantly, international guidelines. Foot shape and mechanics should always be considered when offloading. Do the offloading devices increase the contact area under the foot to reduce pressure? The walls of a walker or TCC can bear 60% of the plantar load. Would a boot be better than a shoe? Is the sole of their footwear rigid, semi-rigid or flexible? Flexible soles encourage movement and will not steer force. And if there is foot deformity, should custom devices be prescribed? It may cost more. Is it necessary to actually offload? Nobody wants to wear an offloading device. They are not fashionable, they look different, feel different, slow you down and interfere with your daily life. But offloading devices do reduce the burden on healthcare resources. They prevent ulcerations, provide quicker healing times and reduce visits. They prevent hospitalisation and reduce the risk of amputation and mortality. Patients are at the centre of all our care plans. Early intervention with offloading can address some of our patient needs, but prevention and quicker healing times are not the full story. Offloading early and effectively can have much wider impact on mental health and wider needs. Nobody wants to visit clinics weekly or to be hospitalised. The impact of longer healing times on mental health, especially during these challenging times, is yet to be fully discovered. Every person wants to keep moving, maintain their independence, be busy and enjoy active daily CH03 Midwest Foot Clinic, working from 2 clinics, one in Limerick and one in Clare, provides a working example of how the community podiatry team, by prioritising early offloading, made a significant impact on addressing patients' needs and escalated service demands. This Launcher Care supported service through Project SIF 343 adopted new ways of working, which facilitated delivery on the Launcher Care principles of right care, right place and right time throughout the pandemic. The first phase focused on reducing lengthy waiting lists for biomechanical assessment, the development of care plans, and where appropriate, the provision of aids and appliances, including offloading devices. The second phase centred around the busy community wound clinic. Patients' reluctance to attend acute settings and restricted outpatient services during the pandemic meant the community wound clinic accepted significantly more referrals from acute services via integrated care pathways. The Midwest Podiatry team rose to these challenges of increased workload by caring for more patients with and without diabetes, and also managing and healing many more wounds. The project outcomes demonstrate the value of integrated care and multidisciplinary collaboration in ensuring the patient comes first. The Midwest Foot Clinic podiatry team worked in collaboration with their colleagues in other disciplines, such as nursing services, physiotherapy, occupational therapy, and dietitians. Established referral pathways with GPs, orthotists, prosthetists, and acute services were strengthened and maintained. This collaboration with colleagues, referral networks, suppliers, and service providers helped to both prevent and heal wounds. The project also engaged with other stakeholders to outsource specialist offloading services and stock and custom-made offloading devices. Multidisciplinary joint clinics were held with orthotists and prosthetists from clinically led prosthetic and orthotic specialist service providers. Patients with more complex foot shapes and mechanics, and therefore greater offloading and healing challenges, were referred for assessment. These patients often requiring the prescription and manufacture of a more complex and custom-made solution. Leaner ways of working were established with suppliers by the provision of call-off purchase orders, which allowed orders to be placed with suppliers weekly on a needs basis by the project manager, who understood the technicality of the products being ordered. This service governed approach eliminated delays, unnecessary stock holding and returns, and significantly reduced the administration time and costs. Supply chain planning and delivery of the right products at the right time occurred throughout the pandemic and this Brexit transition. So when are custom-made offloading solutions and specialist service providers required? There are many types of off-the-shelf stock offloading solutions, such as walker boots, pressure-relieving AFOs, offloading shoes, foot orthoses, and preventative medical-grade footwear. Advanced foot deformity, with or without complications such as diabetic neuropathy, will not be accommodated in off-the-shelf devices or footwear. Complex foot shapes, complex lower limb biomechanics, and delayed healing often require the prescription and manufacture of custom-made lower limb offloading solutions. The value of an early input from orthotists for complex and non-resolving cases is to achieve effective offloading and optimize biomechanical alignment, and should always be considered. So to sum up, could you be offloading more? Is offloading part of your first line management strategy for your patients presenting with a diabetic neuropathic foot? Offloading is the best validated strategy of all current interventions, and the evidence base for much of what we may consider as routine clinical care is thin at best. Is offloading embedded into your wound care strategy? Are you dressing or debriding wounds without offloading them? How long is it taking for the ulcer to heal? Will it heal? Will they be hospitalised? Are you preventing deformity and reoccurrence? How expensive are the dressings? Are they adding any value? Can you do more to offload healthcare resources and improve patient care and outcomes? I'm pleased to let you know that PPL's offloading training programs will be returning soon in an online format. If you want to know more about offloading devices and receive notifications of upcoming training and education, please go to our website and register. Thank you for listening, and I hope you found this presentation useful in offloading some of your own pressures.